tracking the evolution of autism prevalence over the past 2 decades. Introduction. The prevalence of autism spectrum disorder has been the subject of growing interest and concern over the past 20 years. Researchers and healthcare professionals have dedicated extensive efforts to understanding and quantifying the prevalence of ASD, leading to significant advancements in our knowledge of this complex condition. In this blog, we will delve into the changing landscape of autism prevalence, exploring the notable shifts and developments that have occurred over the last 2 decades. The early years, limited awareness and diagnosis. 20 years ago, the prevalence of autism spectrum disorder was estimated to be around 1 in 150 children, according to the Centers for Disease Control and Prevention. However, due to limited awareness and understanding, many cases of ASD went undiagnosed or were misidentified, leading to a significant underestimation of its prevalence. Advancements in awareness and diagnosis. As awareness of ASD grew and diagnostic practices evolved, there was a marked increase in the identification and recognition of autism spectrum disorder. By 2010, the CDC reported that the prevalence of ASD had risen to 1 in 68 children, reflecting improved identification and diagnostic refinement. Epidemiological studies and data collection. In recent years, extensive epidemiological studies and data collection efforts have provided valuable insights into the prevalence rates of ASD. According to the CDC's most recent data, released in 2020, approximately 1 in 54 children in the United States has been identified with autism spectrum disorder. These initiatives have also revealed variations in prevalence rates across different populations and demographic groups, contributing to a more comprehensive understanding of the impact of ASD. Global variations and regional disparities. While the overall prevalence of ASD has shown an upward trend, the rates of diagnosis and identification have not been uniform across different geographical regions. Factors such as access to healthcare, cultural perceptions of ASD, and variations in diagnostic practices have contributed to disparities in prevalence rates. For example, in some regions of Asia, the prevalence of autism spectrum disorder has been reported to be lower than in Western countries, highlighting the influence of cultural and regional factors. The role of environmental and genetic factors. In parallel with the exploration of prevalence rates, researchers have delved into the complex interplay of environmental and genetic factors in the development of autism spectrum disorder. These investigations have revealed a multifaceted landscape of influences that contribute to the prevalence and manifestation of ASD, further enriching our understanding of the condition and its evolving prevalence. Looking ahead, implications for healthcare and society. As we reflect on the evolution of autism prevalence over the past 2 decades, it is evident that increased awareness, improved diagnostic capabilities, and extensive research have all played pivotal roles in shaping our understanding of ASD. Moving forward, this evolving landscape of autism prevalence holds implications for healthcare systems, policy development, and societal attitudes toward individuals with ASD. Conclusion. The last 2 decades have witnessed a transformative journey in our understanding of autism spectrum disorder and its prevalence. From limited awareness and underdiagnosis to heightened recognition and evolving diagnostic practices, the landscape of autism prevalence has undergone significant changes. As we navigate the complexities of autism prevalence, continued research and efforts to support individuals with ASD will be crucial in fostering inclusive and supportive environments for all individuals across the spectrum.